The birth of a child is an unforgettable occasion, a moment in time that will always be cherished and remembered. Dreams of having a family of our own are a natural part of our lives, which is why people are often surprised when they learn just how challenging the process of natural reproduction actually is. In fact, 1 in 6 couples will struggle with natural reproduction.
Natural reproduction depends on a number of factors. The 3 most critical is the presence of a competent egg, a competent sperm, and a very receptive reproductive tract. Within those 3, there's multiple different diagnoses, but if you have those 3, reproduction should occur in the majority of patients.
At least 80% of normal couples will conceive within a year of saying they want to be pregnant. Age is a major factor which can cause a reduction in the chance to get pregnant. And we see most of our patients, unless there are other problems, at age 35 or older.
People may not know that a woman is born with about 2 million oocytes or eggs at birth, and almost 75% of them die away before she's even ready to use them. About 300,000 to 400,000 at puberty, which is when she really starts to use them.
Some little known facts about normal reproduction are that it doesn't happen as frequently as most couples think it will happen. We're sort of high tech, and so we can provide services such as increase the number of eggs releasing. We can process sperm and place sperm inside the uterus to allow for better access to the egg. We can take it to the ultimate limit, which would be taking eggs outside the body, letting them fertilize outside the body, or making them fertilize, and then returning a certain number of embryos to the uterus, which is, of course, what in vitro fertilization is all about. I'd like my patients to know that normal reproduction is what our goal for most patients, to have a normal conception using the least invasive techniques as possible. But I also want them to know that we have every possible asset here in our center to help them conceive, even if it requires in vitro fertilization.
As such a natural part of life, fertility is something many of us take for granted. Life sometimes takes unexpected turns. It's important to be prepared. Being diagnosed with cancer is a frightening experience. In the United States alone, approximately 800,000 reproductive-aged men and women have cancer. Thanks to advancements in cancer research and treatments, patients have reason to be hopeful. Cancer survival rates are higher than ever recorded. With increasing survivorship, medical research is honing focus into the long-term consequences of cancer treatment, especially the effect on fertility. Now, cancer patients can make their dreams of a future family a reality. At the Center for Reproductive Medicine, our team of infertility specialists is committed to protecting your fertility in a holistic and individualized way. We understand that being diagnosed with cancer can be a very difficult time, causing you and your loved ones immense physical and emotional strain. Your first priority is to ensure that you are receiving optimal treatment to cure your cancer and enables you to be a survivor. Part of this responsibility is understanding the effects treatment options have on you and your body. Life-saving cancer treatments such as chemotherapy, radiation therapy, radical surgery, or bone marrow transplantation can negatively impact your fertility.
Cancer treatments affect the reproductive system in several ways. It can affect them in anatomical problems, such as if you have surgical removal of a uterus or an ovary. It can cause scar tissue that can lead to cause fibrosis and decreased vascular supply that can also result in inadequate function of the uterus or inadequate blood supply to the ovary. And of course, it can result in the most common problem would be when chemotherapy causes depletion of the germ cells or oocytes.
Surgical intervention may require the removal of one or both of the ovaries, the cervix, or even the uterus, directly impacting a woman's fertility. Radiation therapy can also negatively affect ovaries, eggs, and the uterus. The dose of radiation and the radiation field will determine the ovarian function after therapy is completed. If the uterus is negatively impacted by radiation, women can have difficulty carrying a pregnancy and may experience miscarriages or preterm delivery. A man may also be affected by chemotherapy, radiation, and radical surgery to treat cancer. Sperm are produced continuously after spermarchy every 74 days. The impact to male fertility may be temporary or permanent, depending on the extent of damage to the maturing sperm or the sperm stem cells. A patient's chance of conceiving after chemotherapy depends primarily on how many viable eggs are remaining. That determines whether or not her oocytes will be viable and whether or not she can use her own eggs. Egg reserve also depends on a woman's age. A younger woman will likely have a larger egg reserve than an older woman. Cancer treatments, such as chemotherapy, are designed to kill rapidly dividing cells throughout the body, while simultaneously leaving other cells intact. Cancer cells divide rapidly, but so do eggs and the surrounding cells in women, as well as sperm cells in men. This means that cancer treatments may reduce the number of eggs or sperm. The extent of this damage depends on the age and sex of the patient, as well as the type, dose, and duration of the treatment they receive. At the Center for Reproductive Medicine, we understand the urgency of receiving cancer therapy as soon as possible after diagnosis. For a man or woman who is at risk of losing their fertility, what are their options? Patients with a diagnosis of cancer can be seen in our center within 72 hours of diagnosis. There, a formal assessment is done to assess their fertility and the impact their predicted cancer therapy will have on their fertility. All options are reviewed, reassurance provided, and assistance as needed to complete fertility preservation prior to cancer therapy. Our team of fertility specialists are here to help you make informed decisions about preserving your fertility, providing you with every conceivable chance for success. For a female patient, the options prior to cancer therapy include oocyte cryopreservation or egg freezing, embryo cryopreservation, preserving the embryo in the frozen state, ovarian tissue cryopreservation, freezing of ovarian tissue, ovarian transposition or transplantation, moving the ovary out of the range of radiation, GnRH agonist treatment, medical pre-treatment to quiet the ovaries prior to treatment. What if cancer therapy must proceed quickly? What are the options after therapy? Once a patient has been cleared by her oncologist, an assessment of her fertility occurs. If her fertility is impaired, her fertility can be enhanced by fertility medications to produce more than one oocyte or egg, in vitro fertilization, where eggs and sperm are combined to form embryos which are then transferred into the patient's uterus. Donor embryos. Donated embryos are placed into the patient's uterus. Donor eggs. Use of donated oocytes in a woman with no viable oocytes to create embryos and place back into the patient's uterus. Gestational carrier, where a woman carries the patient's embryo for her until delivery. Adoption. What are our outcomes? Cryopreservation of embryos has occurred for the last 30+ years. Pregnancy rates were well established to be just lower than the use of fresh embryos for transfer. For patients with cryopreserved embryos, at the Center for Reproductive Medicine, the pregnancy rates are comparable to the use of fresh embryos. Oocyte freezing is still considered experimental by the American Society of Reproductive Medicine, although over 1,000 babies have been born worldwide. This technology can be utilized with a slow or fast freezing method. And for our patients with cryopreserved oocytes using a fast freezing method, have a pregnancy rate of 50% per cycle. Ovarian tissue cryopreservation is still highly experimental, with less than 10 babies born worldwide. Pregnancy rates are low. However, this treatment holds significant promise. Medical management is controversial as there is no clear data that confirms a protective effect on fertility.
Well, with regard to sperm banking, men can leave specimens with us from which sperm can be extracted and then frozen. In fact, and interestingly, there have been pregnancies that have resulted more than 2 decades after freezing. If, on the other side of cancer, after the man has survived, we have low sperm counts or other problems with the sperm, then we can use advanced techniques such as in vitro fertilization to help their wives conceive. Sperm can be harvested by surgical techniques if necessary. If fertility preservation is not an option prior to chemotherapy or radiation therapy, then after clearance by the patient's medical oncologist, we can proceed at that point. Typically, it's about a year later that we want to reassess.
If necessary, therapeutic options include intrauterine insemination. Sperm is concentrated and placed via a fine tube into the uterine cavity. IVF, where sperm and eggs are mixed in the lab, an embryo is created and transferred back to the female. Donor sperm, where donated sperm is used for conception.
Treatment outcomes for men are very optimistic, and it turns out that their wives are actually the rate-limiting factor. With respect to the risk for children, for men who have survived cancer also having cancer, the risks are not greater than the general population. That is, the risks are very low, except in the instance where there might be a family cancer syndrome, and that's a genetically determined problem, and that risk may be the same.
There is no evidence that there is an increased risk of birth defects after cryopreservation or freezing of gametes. In summary, there is hope and reassurance for every patient.
My name is Rachel Bruce. I was diagnosed with small cell carcinoma of the cervix, which is a very rare and aggressive form of cervical cancer. It's actually the rarest form, about 6 months ago. And when I was diagnosed, I was told I had a month before I would have a hysterectomy. I had just had surgery and had to have a month to heal up. And I asked my oncologist about the possibility of storing eggs because I always wanted to have a lot of children and just hadn't gotten around to it yet. And that's when she referred me to the Center for Reproductive Medicine. The doctor found abnormal cells. We didn't think much of it at first, and then when we went back to the specialist, found out exactly how serious the cancer was. It was shocking. It was a whirlwind to hear the words, "You have a very serious cancer and you need a hysterectomy immediately," just flipped my world upside down. And the thought of not being able to have children was the hardest thing for me at first, not even the cancer. It was the possibility of having my future children taken away from me. And I grieved over it for a couple days before I was even able to make a rational decision. When I found out about Fertile Hope and the Center for Reproductive Medicine, when I went for that meeting and found out that there was the possibility to store eggs, it totally changed my perspective. It did give me hope again. It changed my outlook on cancer and this whole treatment process. She referred me to Dr. Gurani at the Florida Hospital Cancer Institute, and it was Dr. Gurani who told me about Dr. Patel at the Center for Reproductive Medicine, said that she had had patients go to her successfully, have their eggs harvested, and have children eventually. Now in my case, obviously I had a hysterectomy, so I wouldn't be able to bear my own children. I would have to find a surrogate mother. Luckily, I have a lot of very close friends, and within a week, 4 of them offered. So I know that I do really not just have eggs stored, I have hope to actually have a child with my DNA. And the funny thing is, well, I try to make light out of everything, is that I am going to get to have my own children one day, and somebody else is going to have the stretch marks from it. So. Well, when I initially met Dr. Patel, there was something about her spirit that I loved. She was very welcoming, and you could tell that she just had a very kind heart and was emotionally invested in her patients in each case. She sat me down one-on-one in her office and walked me through what the process would be like. We pulled out a calendar and marked out what my timeline would be as far as when they thought I would be ready to harvest the eggs. And the crazy thing is, mine was happening right over the Christmas holidays, and their office is set to be closed during that time. And just because of my specific case, they actually had people coming in every day over the Christmas holidays for me. And during a time when their office was closed and they wouldn't normally do anything like this, it was just a few days after Christmas that doctor came in and we did my surgery, which was very quick and simple and actually painless. Early in the morning, and they told me they had harvested 29 eggs and were able to store 22 of them. So it's amazing that I have 22 chances now to have my own child. It gives me a lot of hope. It's really exciting. You know, with the type of cancer I have, it's a day-to-day battle to keep hope alive because of the stories of the women that I've met through this that have what I have, who haven't made it or that are not making it right now. But I have met some women who have made it, and that gives me a lot of hope. And just knowing that my eggs are frozen and that they're there when I'm ready to use them, it's kind of unexplainable. There aren't really words to describe how much hope that brings, because one day when I'm still unmarried, but one day when I do get married and I have that desire to have my own baby, I know that there's a great possibility for that to happen. I am just believing and having faith that I can move on and get strong again. I coach college volleyball, and I haven't been able to be there for my team through this. Physically, really, I've been able to be there emotionally on certain occasions, but they've seen me through this whole journey, and I'm anxious to get back to them and get strong enough to run practices and coach them through matches and be that leader, that strong leader that they need. And I'm just very excited to one day get married and have my own children and move on with life as if cancer was never a part of it.
I'm Tamika Estelle. I was diagnosed with cancer at the age of 23 years old. It was a rare form called vulvar cancer. And I was diagnosed on May 27, 2009. I didn't actually know I had cancer at first. I was doing a normal procedure through my gynecologist. I've always had normal pap smears, and it just happened that I had a lump that I had in my vaginal area for about 2 years.
She gave me information that the doctor found a lump, and she wasn't clear on really what that lump meant, what was going on. She was very worried, and I tried to reassure her that everything will be okay. So
I went to my appointment on April 3rd, and there was no way to tell other than to do the surgery. So after the surgery, I woke with my family there, and everyone kind of drew close.
Me, her mother, her sister, all the family were kind of camped around, waiting to find out the word. And the doctor walked into the room, and you can clearly see on her face that it was something that she needed to tell us, and it may not have been the best news.
Just told me that you're diagnosed with cancer, and My first thought was, am I gonna make it? I don't have any kids. Will I be able to have kids? So am I ever gonna see my family again? Those were some of the first thoughts through my head. During the process, I did have to start radiation. With the radiation process, it was actually kind of cut very close because we were going to be able to try to do the procedure around my ovaries. And the day of the procedure, the doctor called me and said, we're going to reschedule your appointments. And it's a lucky thing that he did so, because if I would have started my procedure that day, later that I find out that my ovaries would have been permanently gone. They would have been permanently burnt and damaged, and there was going to be no hope for me having kids. I was referred to by my doctor through Dr. Garani. Dr. Garani to see Dr. Patel for reproductive medicine. I started procedure there, and I believe it was about, when I met her, I was so hopeful. She gave me reassurance that everything was going to be okay. She was very nice.
When we got to Dr. Patel, she was very positive. As soon as we walked in the room, she had a bright smile on her face. She gave us a lot of the hope that we needed, and Tamika started the process of creating the eggs. Was definitely a strain on both of us, because hey, I'm the guy who has to hold the needle and poke her with it, and she didn't want to. She would stop me and say, "Hold on, wait a minute."
I went through retrieval, and we were able. My fiance was able to watch it on the screen while I was actually doing the procedure. So, out of the 20, 14 of the eggs survived, and I'm just waiting to go forward with having twins, maybe, one or two. So it was amazing.
We just felt so blessed that we were able to be referred over to Dr. Patel and her staff, because they made the process just seamless. They just made it seem like it was a walk in the park. Hey, we do this all the time.
I can't even tell you in words how amazing the experience was. The great staff, they were always there to guide me, gave me inspiring, uplifting words. It was just a blessing that I was introduced to Dr. Patel, because I don't think that without meeting her, I had no idea that there was anything about in vitro, or that I was that there was life after cancer, and she gave me that hope. Every day that I went through my chemotherapy, I went there with a positive outlook on life, knowing that after I finished this procedure, I know that I have 20 kids waiting on me. I may not be able to have all at once, but it gave me motivation to keep going through everything that I went through. I'm in remission right now. It's been 1 year, exactly February 15, 2010. So I'm just excited. I got the okay from my doctor that I'm able to go forth. So within the next, sometime this year, I will be seeing Dr. Patel again, and I'll be having a baby. So, so our plans for the future is 4, 5, maybe 6 kids.
We definitely want to have a large family. We quite didn't get to the talk about the 6, honey, but it's all right. It's okay. But we do want to have we want to have a large family. There's no doubt about that.
I'm very excited. I don't even know what to expect, but I'm just excited to know that I'm able to have a baby, and happy to go forth with the rest of my life with my fiance and raise our child together.
My name is Nadine Sfair. I'm 24 years old, and I was diagnosed with grade 3 brain cancer. I had a seizure when I was studying in the library in New York for the LSAT, and then I went to the hospital, and the doctor said it must have just been stress that I had the seizure, and I was like, it's a little weird because I've never had a seizure before. And my mom insisted that I fly home. So I flew home to Florida, where my parents live, and I got an MRI scan, and it showed that I had a large mass in my right frontal lobe and that it was a tumor. And that it was so large that my brain was so inflamed that I needed to have like kind of an emergency craniotomy. So November 19th, 2010, I had an emergency craniotomy, and they found out that the tumor was cancerous, and it was a grade 3 out of 4, mixed anaplastic oligoastrocytoma, which, I don't really need to know much about that. I mean, at the beginning we kind of just we're like, wow, that's a big word, because, when you're told that you have cancer, there's so many things you don't know. My mom actually was my lifesaver and brought it to my attention, and she was like, we should look into preserving your fertility because you're 24 years old, and since the little bit that we've looked into it, it could definitely recur again, and we don't want to risk, you're 24 now, and with the woman's biological clock being so short, we definitely, don't want to risk it. So I knew that time was of the essence, and, I didn't, as any woman I think believes, you might not be ready to have a child this instant, but it's definitely something you want to do, and I didn't want to waste that. So when I went to the Center for Reproductive Medicine, I was about a month and a half probably out of surgery. I had just had brain surgery, and I had the staples taken out of my head, and I was getting prepped to begin radiation and chemotherapy concurrently 3 weeks from the day that I saw them. So I basically had 3 weeks before I was about to start hardcore treatment. The staff at the Center for Reproductive Medicine made me feel like it was gonna be okay. They made me feel like they cared and that we could do it. When we first met with the doctors and the nurses, they're so warm and welcoming, and they just were so touched by my story, and they were like, this is why we do this, to help preserve fertility for people like you, ultimately. And just knowing that they were there to help me was something that I just, actually I remember the first time I sat there, I just started crying because I was so emotional and I was so thankful for them. And I knew that I gave them a really difficult, time frame to work with, and they still wanted to help, so it was really pretty amazing. They started off doing an ultrasound to see what stage I was at in my cycle, and that they were like, okay, well, we're gonna start you off on hormones, and we'll be doing ultrasounds every so often to check on the growth of your eggs. And this is even a kicker that I don't even think I mentioned. I mentioned that I was from New York when I was up there. I had planned to go back up to New York to go pack up some of my belongings, which was something that I was counting down the hours for them to remove the staples out of my head so I could go pack my things and say bye to my friends before I was gonna go through hell. And Dr. Patel and everyone even worked with me to let me go do that. So I was injecting myself with hormones in the New York airport. It was amazing, and it really made me feel all this has been taken away from me, and they still are trying to make this happen. So that was amazing. They did freeze my eggs. They went in and they removed 7 eggs. It was a completely pain-free process. I just basically took a nap, and then I woke up and they were like, you're all done. And then they give you hormones to put you back on a regular cycle, and they froze my eggs, and so my little babies are popsicles somewhere in South Florida, I guess, being frozen for me to hopefully use one day when I'm cancer-free. No one can see into the future of what's going to happen, and just knowing and having the security that we did try and we did succeed, at least, in securing a hope for your own future, and having children and reproducing is the best gift that anyone could have ever given me. And I mean, I'm proud, you know, that that my offspring and my children are going to be just perfect, happy little babies, you know, and that's because we made this decision to seek this out, and that we had such a wonderful and supportive avenue as the Center for Reproductive Medicine to go to. So I'm very thankful for that. And yeah, I really look forward to beating cancer and continuing with a very healthy, happy family that's cancer-free.
Between cancer diagnosis and treatment, you have a precious window of time to protect your chances for a future family. At the Center for Reproductive Medicine, our team is here to provide you with comprehensive information about the best treatments suited for you and your needs. We want to ensure that you are afforded the full range of fertility preservation options available. Rest assured, you have options.
Cancer patients, when given a diagnosis and are evaluating their fertility options, have lots of choices. First and foremost, cancer patients should know that their primary priority should be cure and or remission. And they should know that there will be therapeutic options before treatment if it's feasible, and if not, with the technology we have available after treatment. So they should have the hope and reassurance to know once they become a survivor, there will be plenty of opportunities to help them become parents. When a cancer patient is given a diagnosis, it can be very traumatizing, emotionally, personally, medically. And at that time, their fertility may be the furthest thing from their mind. They should focus in on cure and or remission. And their fertility, we will work with them to preserve it, and if not, provide them new options. Something they should consider, but not something that should be their first priority.
Rest assured, you have options. For female patients, your best fertility option is determined by your age, your desire for fertility preservation, risks of cancer treatment on your ovarian function, length of time prior to starting treatment, and your current overall health. The first step is to have clearance from your oncologist to pursue fertility options. Then a meeting with a reproductive endocrinologist to evaluate your fertility potential will help determine the fertility treatments best suited to you. Your reproductive endocrinologist will first assess your endogenous fertility. If intact, you may not require any fertility therapy. If you do, there are many options available. Cancer doesn't end your chances of having the family you always dreamed of. The good news is, medical research and evidence-based practice are providing new hope, a hope illustrated in the lives of cancer survivors whose dreams for a family are now a reality.